The odds are we'll all end up in the hospital at some time, and the older we are, the greater the odds. And because we are all getting older, you better pack now. So I'd like to give you a few tips on how to be best prepared. Now, I used to hear some old advice as a kid that you should always wear clean underwear in case you're in an accident. And it always puzzled me because if I really was in an accident, would I have the composure not to poop and pee in my pants? So why bother with the underwear? Better advice is never miss an opportunity to go to the washroom. And of course, in the hospital and everywhere else, wash your hands after. My tip also is not to wear your best favorite Victoria's Secret or Calvin Klein underwear. That goes also for the Superman Under Armour. You never know when we have to use those utility scissors to do an emergency procedure like a cut down, an IV, or defibrillation. So what should you pack? So the first thing are your travel documents, and I don't mean your passport. You need to bring the essential medical information so that your healthcare providers, who aren't your family doctors, know what to do for you. So you need to know your medical history. All of this could be summarized on a single page. And the key things are, first, your allergies. Second, any chronic conditions like diabetes or high blood pressure. Any past illnesses, hospitalizations, or surgery. And very importantly, your family history. The second important documentation is a list of all your medications. Now, for every medication, we need to know the name. So the brand name, which is kind of like your first name, your individual name of the drug. For example, Tylenol. And then the generic name, which is kind of like a last name. Acetaminophen is the drug name for Tylenol. Secondly, you need to know the dose. That could be milligrams, like 325 milligrams for Tylenol. The directions, like 1 or 2 tablets twice a day. And then finally, the reason you're taking the medication. So in this case, you would list Tylenol or acetaminophen, 325 milligrams, 1 or 2 tablets twice a day for knee pain. You should also have a list of any vitamins or non-prescription medications you might be taking. The third most bit of important medical information are your preferences. So if you have any religious beliefs that will affect your medical care, for example, if you can't receive transfusions, you should have that written down. And then secondly, other advanced medical directives. So an advanced medical directive is a statement in writing about what you would and would not want in different conditions. So what procedures do you want to have, and what procedures do you absolutely refuse to have, and under what conditions do those apply? And if you couldn't decide for yourself, and the doctors needed to consult with someone that understood your wishes, who would you choose? So for example, you may not wish to have CPR or chest compressions or electric shocks to your chest. You may not wish to have machines to keep you alive if you had a condition that was not reversible and for which you had a poor quality of life from your own perspective. So some keys for planning your advance directives. Always plan in advance. Talk it over with your family and friends to avoid conflict later. Choose 1 or 2 people that you would trust to respect your preferences. Inform your family doctor and put it in writing. I've seen simpler advance directives, for example, these 2. What's missing though are the date and the signature. So what should you pack for your hospital stay? Well, first think about the comfort items. It might be helpful to have a pair of earplugs in case your roommate snores. My wife uses those. It might be too bright for you to sleep, so bring an eye mask as well. Bring your own music so you can while away some hours if you have difficulty sleeping. And of course, reading material and word puzzles are helpful. A toothbrush and toothpaste is helpful. And in case it gets a little bit too chilly for you, some warm socks, non-slip slippers, and an extra blanket and sweater are helpful. So doctors have a habit of coming in when you're half awake and checking to make sure you're not confused. So it's helpful to know the date and the time. So bring an inexpensive clock just to put on your bedside, and bring a calendar where you can cross off the days. For communication, make sure you have a good pad of paper, lots of pens. If you need them, bring glasses, and if you need them, hearing aids. And if you need extra teeth, bring your own. What you shouldn't bring would be your expensive jewelry, your favorite watches, the expensive smartphones and other electronics. Try to leave your wallet and credit cards at home, and don't wear your nicest clothes or your fanciest shoes. And be careful about bringing your medications. They're likely to take away any medications you've been taking at home. finally, don't even bother wearing perfume or cologne because patients in your neighborhood might have very sensitive allergies or respiratory conditions. And even if the nurse or doctor is very good looking, you don't have to wear makeup.